My presentation is about similarity and the importance of negation uncertainty in the context of the challenge looking for similar patients. The AI Dr. House conquers severe COVID-19. So, as you may know, clinical data is very helpful for us, but there is a problem, and that problem is that only 20% of it is structured. The 80% remaining information is unstructured, and this means that if we want to do something useful with it, we need to be able to convert it to an structured format, so health professionals may use it. However, we can do this manually because, for example, in the Galician health system, Galicia is a region in Spain if you are from abroad. More than 200,000 clinical notes are produced every day. So that's a lot for someone to go manually through them. However, there is a lot of useful information in them, such as COVID-related material that may help us make decisions, or may help us with adverse drug surveillance, etc. So our aim is to transform this clinical text into a structured representation that may be used by doctors for research or for better treatments, etc. So one way to do this, and one of the ways we want to encourage in the challenge today and this weekend, is through semantic textual similarity. We can make the process, the fact that we have so many different reports easier to treat if we group them by similarity. So this technique is called textual similarity, and it has many uses, not only in the clinical domain but also in other domains. We may use it for anonymization, for question answering, for summarization, and in our case for document clustering and classification. And there are many different ways in which we can perform semantic textual similarity. One of them is knowledge-based methods. We also can use statistical methods, and another would be string and sequence comparisons. So one way in which we might want to do this, for example, it's just an idea, is by seeing what kind of concepts appear together, and if we have the same concepts in one document and the same concepts in another, we may say that they are similar. So for example, if we have dry cough that happens a lot with fever and PCR, we may say that those are COVID-19 reports and put them together. But how do we do this? Well, first, if we want to see what words occur together, we need to find what concepts are there in a document. And this process is called named entity recognition. Here's an example. We have a document and we find which chemicals or which drugs are in the document, which diseases, as well as which symptoms. However, is it enough to just find what is mentioned in the text? If we were to give a doctor this document and say that a patient has hypertension and nausea and pneumonia, and they have diabetes and a COVID-19 infection, would it be right? Well, the truth is that just because something is mentioned in the text doesn't mean that it's present. A lot of times doctors will name something because they couldn't find it in their tests, or because they had a suspicion and then they could prove that it was wrong, or that they were right. So for example, in the example we just saw, many entities were negated. So we could also use this type of information to characterize our patient and try to create a profile for text similarity. So now I will focus on two different, well, they are called sometimes extra propositional meaning, because it's a meaning that is in the sentence, but you need some processing to detect it. The first one will be negation. As you may know, negation indicates that something is absent, or that it hasn't happened, or just that it isn't true. And everything can be negated. Diseases can be negated, as in the patient shows no signs of COVID-19. And procedures can be negated, as in performing an endoscopy is ruled out. So we don't need a no or a without to have a negation. Verbs can also negate something. And words themselves can be negated. like in a febrile upon admission, which is a symptom, and a febrile is a negation per se. So it's actually very relevant to find this type of information, since it's reported that around half of clinical conditions in narrative reports are negated. So it happens quite a lot, and we really need to know which symptoms, diseases, and procedures are actually happening. And although historically this field has been studied from many perspectives, such as philosophy, mathematics, and linguistics, from a computational point of view, it has been studied as early as 1994, so around 25 years ago. And another interesting phenomenon is uncertainty, or just certainty. Uncertainty indicates that the clinician is sure or isn't sure about what they're saying. So, for example, if they say that a patient has symptoms compatible with COVID-19, we can't say that the patient has COVID-19 for a fact, or that they have a suspicion of internal hemorrhage. Well, the same. And although from the computational point of view, I would say that it's generally less studied than negation, it's still very common. And in my opinion, this is because doctors don't want to make a blunt statement if they don't have evidence for something. So they can't say that you have COVID-19 unless they have a test result that confirms it, for example. So it happens quite a lot. And unlike negation, there are various levels or various possibilities in which certainty can happen, uncertainty can happen. Something can be unlikely, like it's very likely that the patient will recover, or something can be possible, like it could be that the result was a false positive, and something can be unlikely, like what we used to say a year ago, that a pandemic seems impossible. Well, now that we know what these phenomena are, let's see how we can detect them. On the one hand, we can classify the entities we detected earlier. So, for example, we detected a COVID-19 infection, and now what we want to do is classify whether this disease is affirmed, or is negated, or is uncertain. So in this case, it's negated. It's a classification task. Another point of view is to treat this type of phenomenon from a linguistic point of view. So what we want to do is to find the marker and the scope, which are more syntactic terms, we could say. The marker is what indicates that something is happening in the sentence, and the scope is the part that is affected. So, for example, when we say no anosmia nor ayusa, the marker would be no, and the scope would be anosmia nor ayusa. If you don't know what anosmia and ayusa are, it's I think it's two of the most famous COVID-19 symptoms. Anosmia is when you lose your smell, and ayusa is when you lose your taste. Well, the problem with this point of view is that some cases may be harder to define, because sometimes there are ellipses, some part of the sentence are omitted. Like if we say the patient can repeat words but not sentences, the part that we think might be negated is sentences, but the verb is also negated, because what the patient can't do is repeat sentences. It's not that the patient can't sentences. I don't know if you get what I mean. And another possible problem is that sometimes we might have double negations. So as in active bleeding can't be ruled out. In this case, we have two negations, and we have to figure out whether there is an active bleeding going on, or whether in this case it would be uncertain. And another possibility is that we have something that we would consider negation, such as rule out, but it's actually in a conditional or a hypothesis. So we must be careful about what we say is absent, because it could be uncertainty. And how do we treat these entities, these phenomena from a computational point of view? What kind of systems can we use to detect them? Well, I would say that the first type of system that appeared were rule-based systems, which used a lot of rules, obviously, as well as regular expressions. And they have the advantage that you don't really need annotated data to train these systems because you define them. But at the same time, they are harder to generalize to different types of texts. And well, obviously you need to use some time and probably some linguists to define some rules and to write some regular expressions. And the most famous algorithm for negation is called negex. It's very famous because since the beginning it has worked very well. And it has been adapted to many languages, including Spanish, French, German, and Swedish. But if you look them up in Google, you'll see that there are many adaptations even for the same language. And it is a system that has been improved over the years, for example, by including syntactic dependencies, which is something that is easy to detect using, I don't know, a Python library. So if you look up negex, you'll see that there are many variations. And some of the variations also include uncertainty, which it's something that, from my point of view, is necessary, and even temporality, which is another important aspect in clinical text. And I would like to point out that one of the authors of the Spanish negex, who is Ernestina Menasalvas, will be doing one of the talks that are part of this series. So next we have some more advanced AI methods, which is basically machine learning. And what's the problem with this system? Well, we need annotated data, and this is not always easy to come across, especially in the clinical domain, where there is a lot of problems with privacy and this type of thing. So it's not always easy to have real annotated data. But the advantage is that this type of systems is supposed to be more versatile. So we could use them, we theoretically could use them for more types of text. And you can train a neural network, but you don't need to do that because classic techniques have also been shown to work, such as classifiers or conditional random fields. And I don't know if you follow the news, if you've seen any news about NLP, natural language processing, in the past 1 or 2 years. You have probably heard about transformers. They are everywhere, and they are also the state of the art in this field. We have negbert, which is BERT for negation, and we have a system based on XLNet. Well, both rule-based systems and machine learning systems are evaluated using precision, recall, and F1 score. So I kind of lied when I said earlier that rule-based systems didn't need any type of annotated data, because actually you need something to be able to see how well your system performs. Well, and in case you want to learn or train your own machine learning system, here are some labeled data, some labeled corpora that you may use. As you see, there is a lot of variety from different fields. In English, we have things related to genes and proteins, or paper abstracts, reports, drug-drug interactions. And in Spanish, there's also a great variety. We have real electronic health records, as well as radiology reports, clinical records. And in other languages, we also find that there is less variety, but still there are some resources. If you would like to learn more about this data, this corpora, there is a very interesting and complete paper called Corpora Annotated with Negation, an overview, which is from this year. I would advise you to look it up if you want to read more about them. And actually, Maria Teresa Martin Valdivia, one of the authors of this paper, will be also presenting one of the presentations that are part of this series. And I'm really happy that she's here, because I think she's one of the reference for negation in Spanish. And this paper is not mentioned in their paper because it's newer. Actually, I participated in it, and it's about a corpus of negation and uncertainty with real electronic health records that were anonymized. So I advise you to look them up. So now that you know what negation and uncertainty are, now that you have this information, you may be thinking, okay, so what can I do with this information? Well, here are some ideas. You may try, for example, to compare the signs of symptoms of COVID-19 to other diseases by checking if the symptoms are similar or different or present or not present. Or you may try to find whether symptoms in general in certain patients are present or absent. You may also try to do what's called differential diagnosis, which is also to compare whether certain pathologies are similar or different to each other. And you may also try to maybe create some profiles like pediatric patients versus adult patients, or female patients versus male patients. Another possibility is to see whether there is some type of travel behavior, like, I don't know, the patient traveled in March 2020 to Milan, which I think was one of the first foci in Europe. Or another possibility is to try to use negation to find that which COVID-19 patients didn't have no symptoms, so they were asymptomatic, and what are their characteristics related to symptomatic patients. So that was my talk. I hope you got some ideas. Remember that you can download the data for the challenge in Zenodo. It's also in Discord, the link is there. And here's the bibliography if you want to check some of the articles I mentioned. Here's the second part. Don't worry if you don't get it, because this talk will be on Twitch as well as on YouTube, so you will be able to stop it. And here are some resources. And I would like to say a bit more about the rest of the presentations to finish. Well, first of all, I would like to thank the speakers, because they did a great job in a really short notice. And we have a great variety of speakers from different centers, and we have like clinical perspectives from doctors, and we also have researchers from different backgrounds. So the idea is to give you a general overview of how language and health data relate to each other, so you can, if you have any doubts, you can like build a picture in your mind. We have some talks that are about the clinical perspective, as I just said, and also about artificial intelligence, NLP applications, from the perspective of data science, as well as from resources and terminologies, which might also be really helpful, especially in medicine. And if you want to check them out, here is our YouTube channel. I will share it now on Discord also, and I will give a brief description of each of the talks. Well, that was it. And well, remember, if you like our talks, subscribe to our channel and push the like button. And I would also like to finish by thanking all the participants, as well as the organizers of the hackathon, for their hard work. And remember to donate.